Good morning. Welcome to Salina Regional's Morning Medical. Today's program we're going to be talking about COPD. With me I have Jenni Dunn from Salina Regional Health Center. Jenni, I guess start out, what is COPD?
COPD stands for chronic obstructive pulmonary disease, and it is a smoking related condition. Or it can be from exposure to secondhand smoke as well.
Okay, what are the signs and symptoms we're talking about here?
Usually shortness of breath is what brings them to their primary care physician to be evaluated, but they also have coughing, wheezing as well.
What are some of the testing that you would do for COPD?
Pulmonary function tests, which are lung function tests to help us evaluate lung volumes and gas exchange. That's one of the testing. Chest x-ray can also be very beneficial as well.
Okay, those are done at the hospital or in the clinic office?
We actually have a pulmonary function machine in our office and a pulmonary function tech that does that testing for us. Chest x-ray can be done at the imaging center, which is very helpful because it's right down the hall from our office.
Okay. So what are some of the treatments you do then?
Inhalers and breathing treatments can be helpful in some patients. Sometimes, depending on the severity or their certain type, can or cannot be beneficial. It just depends patient to patient. Pulmonary rehab can be very beneficial for patients as well.
You use the term pulmonary rehab. What all does that entail?
Pulmonary rehab is a exercise class that's at our hospital is run by a respiratory therapist, and it's a class that's specifically geared towards patients with pulmonary conditions, and they're monitored while they exercise. They monitor their heart rate, their oxygen level, their blood pressure, and it's more individualized for that patient so that they can build up their endurance so that they're able to perform more activities. It's not geared to make them be able to run a half marathon or anything, but just to help them build up their exercise tolerance to be able to do more things around the home.
Okay, so if somebody's having some of these signs and symptoms, what's the first thing to do?
Stop smoking.
Of course. And then next, contact their physician?
Yes.
Okay, thank you very much. Thank you for watching. For more information, please visit srhc.com, like us on Facebook, and follow us on Twitter.